The CDC now says that if you're fully vaccinated, you don't need to get a COVID test, even if you come in contact with someone who is sick. Despite that, the state wants to make sure testing doesn't lag behind. WJZ's Live, Rachel Menatoff is breaking down what you need to know about these new testing guidelines. Rachel.
Vic, for those people who are still susceptible to the virus, the state wants to make sure that testing options are readily available. For example, this type of testing, health experts say, is really helpful for kids returning to their classrooms and extracurriculars.
Right here.
At the height of the pandemic, it was nearly impossible to imagine the nation's grip on COVID testing being loosened at any point. But for the first time in 14 months, health officials now changing their stance.
If you're vaccinated, you're safe and protected from getting COVID-19, and you really have a very low risk of transmitting to other people.
If you're one of more than 2.5 million Marylanders fully vaccinated, the CDC says you don't have to take a regular COVID test unless, of course, you have symptoms. Something echoed by Jennifer Nuzzo at the Johns Hopkins Coronavirus Resource Center.
You know, in my view, the routine testing of vaccinated people who don't have symptoms I don't recommend that.
Nuzzo says as the probability of infection drops, that changes the role of testing, but emphasizes symptomatic testing is still very important.
Perfect.
And the state agrees. The health department wants to keep up its testing volume as another way to prevent the spread of this virus. So it's relying on mobile testing clinics like this one at Magnolia Middle School in Joppatown. Harford County is behind the state average when it comes to vaccinations. The number of first doses is at 51% versus the statewide 68%.
Harford County, and like a lot of different places around the state, do have folks who aren't interested in getting the vaccine, so that makes testing all that much more important.
For the Chandler family, it was important for the kids to get a test since school is back in session.
You know, they can still be carriers, and so having them tested and knowing that, you know, they're clean and they're good, especially going to school.
Obviously, the vaccine hasn't been approved for anyone younger than 12, so the CDC says testing in schools can preserve in-person learning. We're live at 11 tonight. I'm Rachel Menatoff for WJZ.